When we think about inequities that exist in global healthcare, our minds first go to conflict zones or countries that are under-resourced. However, the harsh reality is whether in Gaza, Uganda, or indigenous communities right here in Canada, it is the same story, and that is that marginalized populations suffer the most when medical systems break down. Dr. Ben Thomson, a Canadian physician and international humanitarian, has dedicated his career to addressing that gap in healthcare. He's the co-founder of EmpowerGaza, an initiative that works to rebuild healthcare infrastructure in the besieged enclave.
Yeah, so the first time I went to Gaza was 2013, and it was after a round of Israeli aggression and bombing. So some of the healthcare facilities had been destroyed. And so the World Health Organization had made a call out for determining where money would best be invested to redesign and sort of, replenish the healthcare system. I was just recently finished my training to be a kidney doctor, and they made a call out, and I understand there wasn't a lot of interest at the time. I was one of only two people who responded to the request, and it just so happened the other person who responded was a kidney doctor from Palestine.
In Gaza, the challenge isn't just a shortage of doctors. Hospitals are struggling due to a lack of basic electricity. Their facilities are being bombed by Israel, and there is a limited access to life-saving equipment like dialysis machines. EmpowerGaza focuses on long-term solutions, such as strengthening local systems so communities aren't reliant on short-term aid.
Why do we engage the local population? It's simply because they know best. They know best what their people want. They know best what their people need, and they also know best how to deliver it, right? I think the word that I have tried my best to stop using is help, right? And I think the word that we should be using is empower, because overwhelmingly the majority of the time, local populations know what's needed.
Dr. Thomson spoke about how many marginalized people are often the first to be neglected when it comes to healthcare inequity. Even outside places like Gaza, our own Indigenous community in Canada have to deal with barriers such as underfunded clinics, long travel distances, and a lack of consistency when it comes to care. And the reason why is clear.
It's not just availability of medicine. It's not just availability of mental health supports in hospitals. It's the ability to find work and employment, the ability to be free of a justice system that treats them unjustly. The ability to live without being victims of extreme racism.
The parallels across all these regions are obvious. In Uganda, in Gaza, and in Indigenous Canada, it's the most vulnerable who are left behind when medical infrastructure fails. And while the settings are different, the solutions share commonality: empowering the local population, not imposing temporary fixes.
And so if you start with that as a starting point, we got a long way to go, right? But I think that the way that we address that inequity is not by saying, well, let's build hospitals in rural Uganda. Let's make sure there's always medications there. It's thinking about more simple things, saying, well, how is it that the majority of the population in Uganda lives on less than $1 a day?